This topic, it's based on our practice in the hospital. Whenever Ramadan is approaching, we receive plenty of patients with different diseases asking us and other members of the healthcare team about Ramadan fasting. And although they know that some of them are exempted from fasting, but they choose to fast. And some of this group is the diabetic patients, and strangely that even the pregnant women who are exempted according to Quran and Sharia, exempted from fasting, and then they can make up the fasting later after they give birth, they decide to fasting. And on top of that, we find that some of the diabetic pregnant women, they choose to fast during Ramadan. First of all, I will give you an idea about the prevalence of diabetes around the world. And in 2015, the International Diabetes Federation published their Diabetes Atlas. And the statistics show that 415 million adults with diabetes globally, and 199.5 million are women. 318 adults are at high risk for developing diabetes or impaired glucose tolerance. And the projection for 240 is that from having one diabetic among 11 adults, it's expected that it will go down to 1 in 10 adults by 240. And if we look for diabetes by gender, for women in 2015, we have 199, as I said, 0.5 million women with diabetes. In 2040, it will almost increase by 313 to reach 313 million. And it's expected that 1 in 7 births is affected by gestational diabetes, which is the type of diabetes that affects women during pregnancy. In 2015, the United Nations member states in New York adopted the post-2015 Development Agenda and Sustainable Development, and one of the targets is also to tackle the non-communicable diseases, and diabetes is one of them. All diabetes management and evidence-based practice guidelines are aimed for individualizing care of these people, and the aim is to attain the patient's physiological needs, their psychological needs, and considering their cultural backgrounds and cultural needs. Several countries were not able to develop such guidelines, and we know that there are some guidelines designed or developed by Australians, by Canadians, by Americans, by here in UK. And why is that? That most of the countries don't have their own guidelines, maybe because of the lack of expertise or financial resources. And some of them, they have lack of awareness of the International Diabetes Federation developed guidelines. Now, regarding Ramadan, Ramadan was last month, 3 weeks ago, I think. And if you look at the hours of fasting, it is variable according to the geographical location of the country. This year, the shortest period of fasting was in Chile, 9.5 hours. This is the total duration of fasting. The longest hours of fasting is in Iceland, 21.5 hours. And we know that Ramadan fasting is obligatory for all adult Muslims, and it's a lunar month, so it will last between 28 days up to 30 days every year. And regardless of the season, sometimes it falls in summer, sometimes it falls in spring, sometimes, so different seasons, different periods of fasting. And as I said earlier, some people are exempted from fasting, including travelers, pregnant and lactating women, menstruating women, people who have chronic diseases, and they have fatwa or permission to fast, not to fast during Ramadan. And now, to have a good idea, I put this map regarding the regional distribution of Muslims around the world. And you can see that in Europe, 5.9% of the Muslims in the world, they live in Europe. The majority in Asia Pacific region. And Middle East, 93% of the people of the Muslims are living in the Middle East. Sub-Saharan 30%, and 0.1 in Latin America and Caribbean. North America, 1%. If at the same map, when we looked at the projected number of Muslims by 240, we can see that there is an increase. For example, in Asia Pacific, they will increase a number from 24.3 up to 28.3. In Sub-Saharan, 34%. And in the Middle East, from 93%, it's almost the same. In Europe, from 5.9, they will represent 9% of the total number of Muslims around the world. North America, it will increase from 1% to 2%, and then Latin America from 0.1, it will be almost the same. And now, in the map of the world, when you look at the distribution of diabetics, you will see that in Europe we have 71 million who will have diabetes in 2040. And for the rest of the world, the number is increasing, and so diabetics are everywhere, which means that diabetic pregnant women are distributed all over the world, and they might practice Ramadan fasting. Now, many studies has examined the prevalence and effect of Ramadan fasting among type 1 diabetics and type 2 diabetics. For those who doesn't know the difference between type 1 and type 2, for type 1, mainly it happens in children, and it happens as a result of complete absence of insulin production. For type 2 diabetes, it's mainly in adults, and there is insulin resistance, or they have decrease in the amount of insulin production. Now, 90% of healthy pregnant women practice Ramadan fasting, and many studies looked at the pregnant women who fast during Ramadan. There is contradiction between the results of these studies. Some of the studies says that there are no effect of Ramadan fasting on them or on the outcome of the pregnancy, and some of the studies say that yes, there is some effect. So among healthy pregnant women, there is contradiction, and in the literature, it was documented also that the pregnant diabetic women also they fast during Ramadan, as I said earlier. Now, the purpose of this paper is to explore the literature, looking for the guidelines or some publications regarding the management of this group of ladies. And I used a systematic database search using Scopus, PubMed, Medline, and Web Science, using the keywords of Ramadan, fasting, diabetes, and pregnancy. And this was conducted in November 2015. Now, I didn't find enough studies. I only found 4 studies that talks about Ramadan fasting and diabetic women, pregnant diabetic women. 2 studies were conducted here in the United Kingdom, and 2 studies in Islamic majority countries, mainly Malaysia. The sample size of all the 4 studies is 348. 80% of the diabetic pregnant Muslim have fasted more than 15 days. So it's a reality, they do fast. Although they are advised not to fast by their physicians and by imams. Hyperglycemia and hypoglycemia episodes were also present, and there is an increase in the insulin dose during Ramadan, which is stated by Noor Aslan in the study that was conducted in Malaysia. There is most of these women, they did not discuss fasting with healthcare providers or imams, so they just decided to fast and they did it. No association between fasting and preterm delivery among all of the study populations. Now this table summarizes all the 4 studies, and you can see here that fasting hours when among the group who fasted in United Kingdom in 2014, which is published in 2014, were 18 hours. This is the longest. And most of them, they have GDM diabetes, gestational diabetes. And the gestational age, which is the age of the pregnancy, when they did the fasting, mainly in the second trimester. We divide pregnancy into 3 trimesters. The first trimester, the first 3 months. Second 3 months is the second trimester. Third trimester is the last 3 months of the pregnancy. The number of fasting days, most of them, they fasted more than 15 days during the month of Ramadan, which is half of, or more than half of Ramadan. And in the study that was conducted here in the UK, they fasted 20 to 29 days. Most of them, 76 of the women in the study, they fasted 20 to 29 days. Now, the studies looked at the control of diabetes, looked at the effect on the control of the diabetes, measuring protein in the urine, and the incidences of hypoglycemia, which is the low blood sugar, and hyperglycemia, which is the high blood sugar. But none of these studies looked at the birth outcome except for the one in the United States, United Kingdom. And by the way, for the last one there, this is a large cohort study, was conducted among 10,000 women, and the aim was not to look at diabetes and pregnancy and its relation with fasting. The aim was to look into to look at the health of those women, and they took a sub cohort, more than 300, around 300 women, and they looked at their practices during Ramadan fasting. And by chance, they found that there is around 20 women out of 128, they did fast during Ramadan, and they have diabetes. So it was in the table. It wasn't mentioned inside the study, but I found it in one of the tables of the results. And as I said, the rest of the studies didn't look at the outcome of the pregnancy or the health of the baby, or they didn't follow up the babies after delivery. Now, this year in 2016, in May, I think, in April, the International Diabetes Federation published the first Diabetes and Ramadan practical guidelines. I went through the guidelines, and this is after I did the review. Nothing is mentioned about gestational diabetes and the management of gestational diabetes during Ramadan among pregnant women. And even for type 1 and type 2 diabetes, the guidelines were general. And you can see here that they just mentioned that pregnant women with gestational diabetes are within the category 1, which is very high risk group, and category 2 also, which is the high risk group with type 2 diabetes and pregnancy or gestational diabetes. They shouldn't fast, and they have to, if they want to fast, they have to seek medical advice, and no other further guidelines or any indications on how to manage them during Ramadan. Thank you.